No. Here we go. So thank you again for joining. My name is Laura Santner. I'm a social worker. I'm also actually a poetry therapist. If you want to know more about that, ask me about it. I'm in New York, and I've been working with BFRBs for a really long time now. So I really hope that I can answer your questions. Please feel free to write in the question and answer box as many questions as you'd like. If I'm answering questions and you need clarification or have any follow-ups, just write in the box as well. If there's something I cannot answer for whatever reason, just send us an email at support@trickstop.com and we'll get back to you and I'll look further into it if I can't think of an answer on the spot or if something needs more details or a follow-up. So this is going to be pretty casual. I'm going to go over the pre-submitted questions first, and then I'll go over to your questions. So we have a bunch of pre-submitted questions. Actually, before we even get to that, I hope everyone's got like a drink of water with them and a fidget. Feeling good? My fidget, let me see. I always have little fidgets on my desk. This is a really fun one. I like this one. It feels really good when I just kind of squeeze it, pop back and forth. So I got this fidget with me today and I got my little spinner rings. So I hope you have a fun fidget with you for today. Okay, so first question is, what is the cause of hair pulling and why is this happening to me? Okay, so the cause is not entirely known and it's rather complex. So far research is showing and is saying that there is an inherited predisposition. So there is a genetic component. However, there are also additional factors. So just because you have a genetic predisposition does not mean that you're going to wind up pulling your hair. So it's a combination of maybe that along with your hormones and temperament, age of onset, any co-occurring disorders, and environmental stress factors in different stressful situations. So it's a variety of things. So hope that makes sense. And again, just because someone is maybe genetically if someone has it genetically, if it's in your family, and none of these other factors are kind of going on, you might not ever get it, might not ever get activated. Okay. Excuse me. I have never told anyone this, not even a doctor, but I pull my hair really bad when I'm bored and watching TV and when I'm nervous sometimes. I've been doing it for 5 years, off and on now, and it's gotten really bad. I have a 16-month-old son that keeps me on my feet. But with that said, my anxiety has went up. That's natural. Yep. Anyways, I wanted to know of any methods to stop or anything. I've gotten some bald spots now, and it makes me want to stop even more. Okay. Um, yeah, so those are some pretty common situations for pulling. Um, I would first recommend, I would actually recommend joining the program just so you have some additional support, someone to talk to, get more information, get knowledge and help guide you through different strategies. If that's not something that you're interested in, there are also different support groups that you can participate in. Support groups are readily available now. There are many virtual support groups which are accessible for all locations. So I do suggest support groups. Um, Actually, there's also a Facebook group. It's called BFRB Moms. So you mentioned you have a 16-month-old, so it might be nice to get some specific support from other moms. Um, by the way, I'll just repeat, I'm noticing some hands being raised. I'm not going to be able to call on you, so write any kind of questions that you have in the question and answer section, and I'll address that after. Okay. So in addition to that kind of level of support, if you kind of just want to work on your own, some things I would recommend: start off doing some tracking. So tracking and journaling, so you can kind of figure out what your patterns are. So what are you thinking? What are you feeling? What are the different situations? Where are you located? Like, what's happening? So once you kind of figure that out, that will help to guide you into different strategies to try. So different stimulus control strategies and different competing response strategies. So for example, you might want to think about the acronym SCAMP: sensory, cognitive, affect, motor, and place. So sensory are like using different fidgets. So that's something that you can try. Cognitive is like trying to rephrase, notice what your thoughts are and trying to rephrase them. Effective strategies are coping with your emotions. So just for example, like breathing, trying to relax. Motor strategies is blocking yourself. So using barriers like gloves, hats, band-aids, things like that. And place strategies. So changing your location in your home. So just for example, sit on the floor instead of the couch. Um, cover the mirror, right? You're changing the environment. So definitely recommend trying that. You can also practice some meditation and mindfulness practice. That's always helpful. TrickStop has done some webinars in the past on this topic, so feel free to go and check that out. Those are pretty good. And in addition to past webinars, you can also check out just some blogs, just different blogs and articles, just to get more information, more tips, and see what you can do. I would also add, it's hard with a 16-month-old, but think about what your routine is. Try to be as structured as possible. Keep yourself busy, and ask yourself, what are my urges telling me? It's kind of like your urge is like another language. So, and you're trying to figure out what it's trying to say. So what is it telling you? What does it need? What is missing? Another thing you could do when you're at home and experiencing urges and struggling is books, readings, self-study, self-help books. So for example, let's see. So there are lots of books. I got a couple right here to recommend. We have Overcoming Body Focused Repetitive Behaviors. Okay. This is a really good one. This is like a staple, I would say. It was somewhat recently updated. This is Charles Mansueto, Sherry Mansfield, and Ruth Gollum. Okay. We have, this is a little bit older, but still a goodie. Help for Hair Pullers. This is Nancy Kuthin, Dan Stein, Gary Christensen. So that's a good one to check out. We got the Trichotillomania and ACT Enhanced Behavioral Therapy Workbook. Workbooks are really nice because you're kind of like working through it, and there are different like worksheets in there and different kinds of charts. So these are kind of nice. This is also a little bit old now, but still a good one. And the newest one I would say that just came out, which I don't have yet, is the BFRB Recovery Workbook. So that one's by Marla Deibler and Renee Renardi. So people are really liking that one as well. So that's what I would recommend. You mentioned stopping, right? Of course, everyone wants to stop, wants me to stop even more, is in your question. So I want to encourage you to think about it in terms of management instead of stopping. When you think about the idea of stopping, it puts a lot of pressure on yourself and it winds up stressing you out more. And then you wind up pulling more. So if you think about it in terms of management, it helps with some flexibility, more room for self-compassion, and self-understanding. And then you naturally wind up having fewer urges and not as intense and wind up decreasing or actually stopping pulling. But telling yourself to stop puts more pressure on yourself. Okay. Sorry, that was kind of a long answer. Hope that was helpful. Okay. Oh, my 2-year-old daughter pulls her hair, eats it, and then sucks her thumb when she is going to sleep. We have been using a thumb guard to help her from sucking her thumb, and so far this is helping her from pulling her hair. Okay, great. I'm afraid that if we stop using the thumb guard, that she'll start to pull her hair again. Is there anything else we can try? So I will say that eating hair, that's called trichophagia, and it can actually lead to some serious complications. I wouldn't be too concerned about it, the complications in a 2-year-old at this point. But if it continues, it can cause intestinal blockages. That's called trichobezoar. So it is something you want to make sure that the doctor is aware about. So different kinds of strategies for hair eating. I would specifically say like chewing on things. So chewing on, people like dry spaghetti. I prefer things like bean sprouts because it's got the little like bulb and it's like stringy with the bulb. I also, for a 2-year-old, would maybe recommend something like string cheese because you can kind of pull it apart. And so it's kind of fun to pull apart and also eat. So that would be some edible things to try. I also really like chewable jewelry. That could be really satisfying, not necessarily for a 2-year-old to be sleeping with. However, so you might want to think about that. But just in general, chewable jewelry is really nice. Or any kind of fidgets that are rubber. I really like. I really like this guy. This is for 18 months and over. It's called the Funny Puller. This is really great because you can pull it. It's got some resistance. There's some fun textures to it. And you can chew on it. I think it's meant for like teething, but 2-year-olds is great. So this, and it's got some other, things, poppers and things on it too. So this is really great. So this is something that you could put a 2-year-old to bed with. I don't think it's a hazard. You can always double check the instructions. But this is a fun one. And actually, this fidget, by the way, I recommend for anyone, not just a 2-year-old, because it's really fun. It's a really good one. Besides things like fidgets, if the guard is working, stick with it. Continue with it. You can also switch it up, try gloves, but using like fidgets and different techniques and have the guard on at the same time, and you can also practice using strategies not at nighttime, just during the day. So your 2-year-old kind of gets used to using different strategies. So that might help at night. So that combination of things. I would also say for nighttime, be mindful of your nighttime routine. Keeping a routine can be really helpful. Keeping things kind of calm, relaxed at night. Maybe put some music on to help set a nice environment. Yeah, keep it some reading, singing, just things that will kind of help slow down and relax. Stuffed animals, right? Something that your 2-year-old can kind of cuddle with and pet. That could be really soothing. So this would be some of my suggestions. I would note that if you're seeing signs of trick so young at 2 years old, this is considered baby trick. So most likely they'll grow out of it because right now they don't understand how to self-soothe themselves. So I wouldn't be too concerned. Okay. If you can address the topic of medication and trick on the Zoom meeting, I've tried different types of antidepressants and nothing worked, and some of them made me pull even more. So yeah, so actually there is no medication for treating hair pulling. Antidepressants help with depression and with anxiety, and that can certainly impact your urges and impact your pulling. Um, but BFRBs are not an anxiety disorder, so and it's not a depressive disorder. So an antidepressant medication is not going to work for BFRBs. Um, they they can have side effects. And you're right, they can make your urges worse. So if you're taking a medication and your urges are increasing, that is not the right medication for you. Um, that said, things are always worth a try. Different things work for different people. So definitely consult with your psychiatrist. Right now, in terms of medication, the most researched and the most promising. It's an amino acid supplement. It's called NAC or N-acetylcysteine. Um, or even the newest one that's just kind of starting to get some buzz is memantine. So those are the two right now, but talk to your psychiatrist um, and don't take anything without consulting with your psychiatrist. Okay. Um, I've been struggling with hair pulling. I've been struggling with severe hair pulling for 7 years. I have all the tools and knowledge, but still pull. Do you know or know of any studies that suggest medicine is very effective? I just find myself forgetting to use my tools because pulling the hair has become natural and I don't feel sad about it in the moment. Yeah. So again, right now there is no medicine, unfortunately, um, that's going to help with hair pulling. The most promising, the ones with the most potential right now are the NAC and memantine. Um, but even with medication, it's really important to use your strategies. There is not going to be a magic answer, unfortunately, or a quick fix. So in order to remember to use your strategies, something that I find helpful and that I typically recommend is actually making a chart for yourself of the strategies that you want to use for the week, let's say. So you put like, the weekdays on the top and your different strategies on the bottom. You can start off with like 3 and you can slowly add to it. And what I really like about that is it's a nice reminder and you can check them off every time. You can have multiple checks in each box. And it feels really good. And when you see all those checks and you see it in your chart, your strategies that you want to try and that you're using, it helps to motivate you. It helps to remember, to motivate, to feel good. So that's what I would recommend. Okay, let's see. How much do you guys recommend taking NAC for moderate trick? And what are the average doses? Um, so again, me and Trick Stop, we don't like endorse medications. We don't necessarily encourage medications. Um, so I'm not gonna say we like necessarily recommend or not. But I do, so I say consult with your psychiatrist if you're thinking about it. What I will say about NAC is it has very little side effects. It's an amino acid, so it's pretty appealing. um, it's great that it doesn't have a lot of side effects, so people do like it. Whether it works or not work, I don't know. Some people say it really works. Some people say it doesn't. The dosaging is like kind of all over the place. So typically, research and doctors recommend starting at 1,200 milligrams. But it's short acting. So because it's short acting, they typically recommend starting with like a 600 milligram tab like in the morning and then a 600 milligram tab in the evening. Um, So that's kind of the general starting point, and then take it from there. I don't know how much you can increase it to. I think to quite a bit. But again, make sure you're working and talking with your doctor. Okay. Okay. Very good. We got a bunch more pre-submitted questions. So again, I'm just going through the pre-submitted questions, and then I will get to your questions. I see some notifications there, so I will look at that once I'm done with the pre-submitted ones. Okay. Um, there seems to be confusion in trainings. This says from a therapist. There seems to be confusion in trainings, research, papers, threads, comment sections, etc., about how this is classified, trichotillomania, in regards to being viewed as similar or on OCD spectrum or an anxiety disorder. I know it is listed separate in the DSM-5, but some trainings suggest it is an anxiety disorder, or more recently, being looked at similar to how OCD works. Can you clarify any new research around this? So, yeah, it's a little confusing. And where it's been classified in the DSM has been kind of like a long debate and battle within the trick community and within those that make the DSM. So trick and BFRBs, body focused repetitive behaviors, they're not an anxiety disorder. Um, that said, anxiety does have an impact on urges, certainly. And it's also a common co-occurring disorder, but it is not the same. Someone can have a BFRB, can have trick and not be anxious. Their main trigger could be understimulation, such as boredom. So you do not need to be anxious in order to have trick. It's also not OCD. So it's not OCD. It's kind of like a cousin to OCD. So it is categorized as OCD and related disorders. It is related, but not the same. So for example, BFRBs are treated with a combination, they're treated differently. So BFRBs are treated with a combination of cognitive behavioral therapy, the comprehensive behavioral model, acceptance commitment therapy, dialectical behavior therapy, habit reversal. OCD is treated with exposure and response prevention. That's the main treatment for OCD. You would not treat a BFRB with ERP, or exposure and response prevention. BFRBs also do not respond to the same medications that work for OCD. OCD involves obsessions that increase anxiety and compulsions that then reduce that anxiety, at least temporarily. People with BFRBs don't have obsessions such as, if I don't pull this hair, something bad's going to happen. Instead, you're pulling to serve a purpose of reducing negative sensations, different cognitive emotions. It's self-regulating, self-soothing, self-regulating. People with BFRBs, they often do not want to even though it really bothers them, it's hard to obviously stop. So it's upsetting, but it's kind of becomes somewhat part of you. So it's really hard to let go. People with OCD tend to say that they cannot stand rituals and that they feel compelled to perform them. So there's a difference. Sorry if that last bit was like a little bit confusing. I'm not sure if I explained myself well there. But basically, trick and BFRBs, they stand on its own in terms of categorization. So, and where it belongs in the DSM, again, it's been kind of this long-standing debate. So right now it's categorized as OCD and other related disorders. but it's not OCD and it's not anxiety. So hope that clarifies it a little bit. And again, if you need more clarification, actually, I believe there was a webinar that TrickStop did on this. Yes, on trichotillomania and OCD. So check that out. They might have done one on, sure, it's there on anxiety as well. So just take a look and see what they got. Okay. If your hair texture changes on a particular part of your head, is it possible for it to ever change back to its original texture? Yes. Yeah. So when hair grows back, it usually grows back a different color, a different texture, a different thickness. So don't be discouraged. It will kind of sort itself out and it will go back to how it was originally. It just takes a little bit of time. I like to say like the hair and the hair follicles are a little bit in shock, so it might come out looking a little bit different at first, but it will get back on track. Okay. Yeah, so do you have any product recommendations for hair growth? Um, so I will say that I feel like um, different kinds of companies kind of prowl on people with hair loss because they know that we're suffering and that it's difficult and that, you know, everyone will do anything to try to make hair grow back as fast as possible. So I don't know if anything actually works. Um, that said, I like to kind of use different products or encourage people to use products because it makes you feel better, makes you feel like you're taking an active stance. It's part of self-care. When you're treating yourself kindly and engaging in self-care, you're going to feel better. So then it might wind up working just because you're helping yourself. Um, that said, I'm hearing things that minoxidil, if you're familiar with that or heard of that, works pretty well. However, um, all however, like ingesting it, like a pill form of minoxidil instead of a hair cream works better. Same thing with like biotin and collagen. I like those too. But again, ingesting typically is better than surface like a shampoo or conditioner. But I still like, you know, creams and foams and shampoo and conditioners and things like that. I did a little research, and so um, I do have a little bit of information about different oils because some people do really like oils. So, for example, I'm just going to read to you what I discovered. Um, so, lavender oil promotes cell growth, prevents stress-induced hair loss. And according to a 2016 study, lavender essential oils led to a 99.8% increase in lab mouse hair growth over 3 weeks. So that kind of sounds nice. I like the sound of that. I like that these are natural things that you can do. That again, it's all part of self-care. Anything self-care that's not going to hurt you, you're treating yourself kindly, it's going to help. Peppermint essential oil. So that supposedly increases blood and nutrient circulation to your scalp. So that accelerates hair growth and can prevent hair loss. This contains methanol, which creates a cooling effect that stimulates hair follicles. And by the way, things like that, like methanol, that like tingle, that can be like a really cool sensation. It can be pretty satisfying as well. Um, in a 2014, again, mice study confirmed that peppermint oil increases the number of follicles and their depth, improving overall hair growth and thickness. In a 2010 aromatherapy study, a blend of thyme, lavender, cedarwood, and rosemary essential oils contributed to significant scalp regrowth. Rosemary oil contains carnosic, I'm not sure what that is, carnosic acid. So that apparently increases circulation, cellular turnover, nerve growth, and leads to thicker hair. its stimulative properties also balance oily discharge around your follicles. So I just did that research because I wanted to know more about oils, and I saw that question. I found that information. There's a lot more details about that. This was on a blog, herbcottage.com .au/blogs/aromatherapy/essential oils hair growth. Okay. Is there any research on the benefits of neurofeedback on trichotillomania? Oh, yeah. Interesting question. So I have not heard too much about neurofeedback and trick. The idea behind it is that by harnessing the power of your mind, you become aware of what's going on inside your body, and then you can gain more control over your behaviors. There's a really good article on biofeedback on trickstop.com. It's an older article, but I think it's still quite relevant. So that one's on trickstop.com, and it's just, if you look up biofeedback trichotillomania, you should find it. It's a really interesting article. So treatment, I would say right now, as I mentioned before, it's a combination of things. So primarily the comprehensive behavioral model, or COMB, also CBT, cognitive behavioral therapy, DBT, dialectical behavioral therapy, ACT, acceptance commitment therapy, habit reversal, HRT, and some clinicians are mixing in other things. So for example, like motivational interviewing can be really helpful, and also just taking different psychodynamic approaches. So really, anything that you're doing, it's going to be about the combination of things. So there's not going to be one specific treatment. So even if you're doing neurofeedback, you want to combine it with other things like habit reversal training, like the comprehensive behavioral model. So a combination of things. That would be my recommendation, at least. Okay. And I think this is the last pre-submitted questions, and then I'll get to yours, the live ones. Is there any research on benefits of ketamine treatment for trichotillomania? And do you consider trick under the umbrella of OCD, or see it more as a process addiction behavior? So I'm not familiar with ketamine treatment for trick. Again, the most researched right now is NAC and acetylcysteine, and memantine is starting to be up and coming. So I would kind of stick to what's most researched as of now. So yeah, I would be a little bit hesitant about trying ketamine. You would want to, again, talk to your doctor before trying anything. And as I mentioned before, so BFRB is not OCD. It's also not an addiction. So it doesn't respond to those same medications. So again, it's currently categorized as OCD and other related disorders, but it kind of just stands on its own since it doesn't respond to the same treatments and the same medications. So I hope that answers your question. There is, again, there's a webinar on, not on ketamine, but on trick and addictions. So trick and OCD, there's a webinar. There's also a webinar on trick and addictions. So you can check those out. Okay. So I'm going to now go to your question and answers. And again, as I'm answering your questions, if you want clarification, you want me to expand on something, you want to correct me, go right ahead. Just write in the question and answer chat. Why don't they have medications for hair pulling? I know, right? I love this question. So they don't have medication yet for hair pulling because It is not researched enough. It is not researched enough because it is not well known enough, because people, it is still too quiet. We need to be loud. We need to get out there. We need to be heard. Researchers need to know that so many people suffer with this. When researchers realize that so many people are affected with trich, they're going to get more funding. So it's about getting funding and being able to do research. The more funds, the more research, the more likelihood we are going to find a medication. So I sure hope one day. But it's really about just getting the word out there, um, to spread education and awareness so we can get more money for research, so we can get medication. Are fluffy stuffies a good alternative to hair pulling? I don't know what a fluffy stuffy is. I'm imagining it's like a stuffed animal, of some sort. So why not? Maybe you can clarify or expand. I can also look it up later. But yeah, any kind of like stuffed animal or doll, where you can, if you're pulling off of a stuffed animal or a doll, that's fine, right? It's close. It's close because you're pulling on something, but it's not on your head or your arms, or anywhere on your body. Um, and you can also cuddle with it. So yeah, I would say why not give it a try. Again, if you're trying something and it's just not working, or you're noticing it's increasing your urges, then it's not the right strategy for you. I have a bad habit of pulling my eyelashes once in a while. At the moment, it's gotten out of hand. I wanted to know if there's a specific type of therapy I should request for. Yeah, so eyelash pulling, is within the category of trich. So the type of therapy would be, as I mentioned before, that combination of, of comprehensive behavioral model, CBT, DBT, ACT, habit reversal. Um, so it's that. So when you're looking for a therapist, you want to see that they're familiar with those modalities, and that they know what a BFRB is. Um, so so that's what I would suggest. Yeah, so for eyelash pulling, the treatment is the same for hair pulling. It's the same for body hair pulling, for example. It's the same. Okay. Um, have you ever heard of pulling an animal's fur, not doing anymore, but did previously? Yeah, I mean, yes, people do that. Um, yeah, people who have trich, might pull from, from their own head or body, but they might also pull from others. So other family members, for example, even friends, other people, or animals. So yes, it can happen. Um, so yes, the answer is yes, I've heard of it. It happens. Um, Oh, yeah. So when you talked about the oils, I noticed you mentioned scalp only. Does research show it can be safely rubbed, ooh, on eyelashes as well? I'm not sure. I would be a little bit weary about eyelashes, putting oils on eyelashes, just because it is so close to the eye. So you would have to look that up. I am not an oil expert. That was like my brief little research that I did. So you might want to look into that further to see what is safe to use on the eyes. There are plenty of products, that are safe for eyes. I don't know them off the top of my head, but they do exist. Um, so you could look that up. Basic things. Well, for soothing, for eyelashes, you can do things like Vaseline. That's pretty safe for the eyes. Um, but in terms of oils, just double check. Um, again, because it's natural, it's probably okay. I would not do the peppermint oil just because, again, that's menthol and that will most likely sting if it gets in your eye. So that one I would probably stay clear from. But I would talk to an expert, someone who's an expert in aromatherapy and different essential oils, and just see where on the body is okay to put. So just double check with that. Yes. Have you ever heard of NOCD? I believe their therapists are trained in both OCD and trick. um, yes. And a lot of therapists who are trained in OCD also took training for BFRBs for trick. So not just NOCD, but just OCD in general. Um, um, because there is a strong a likeness, similarity, because they're kind of like cousins. Um, a lot of the therapists who are trained in OCD also work with folks who have trick, but not necessarily. So if you are looking into an OCD therapist, just make sure they're familiar with BFRBs. Okay. And I have a lot of trouble finding therapy locally. Yeah, good question. So I don't know where your location is, but there are a couple of places you could look. So trickstop.com does have a section where you can find a therapist in your area. Um, BFRB.org also has a pretty long section, so you can search by your state and see if there's anyone trained in your area. On those two websites, the people that are on those websites are going to be trained. You could potentially also look on the OCD website, the International OCD Federation or Foundation, I believe. They also have a provider list by state. And then again, if you're I'll just repeat, if you're looking at an OCD specified therapist, you do want to make sure they're familiar with BFRBs because they're not necessarily. So really on the TrickStop and BFRB.org are the really good resources to find a therapist locally. If you cannot find a therapist locally, I do suggest considering joining our program because all of the therapists in the program are highly trained, highly knowledgeable, and you can be located anywhere and still have access to the program. So that's a really great benefit of the program. So even if there's no one in your area, TrickStop is available and it's a really good resource. Okay. I have had trichotillomania for 10 years. Just when I thought I had stopped my hair pulling, I developed a new habit. I like to pull at my split ends and break off the ends of my hair, which seem to stop my previous habits. I always find new ones to replace them. Any suggestion? Yeah. So, um, I'm not sure where to start here. I got a lot of thoughts in my head. So, um, so when you have a BFRB's trichotillomania is chronic. Um, so that means that yes, you can stop for 10 years, right? But a part of it is going to always be within you. So it can be deactivated for a really, really long time, and then something can happen and it can kind of reactivate it. So that's just something to be aware of, I guess. And another thing with BFRBs is they kind of move around and they can change. So if you have managed or you say stopped, if you stopped hair pulling for a really long time, again, because it's chronic and that urge is kind of deep within you, it might try to find a way to kind of sneak its way in, but in another way. So instead of hair pulling, maybe for you, it came out as breaking the split ends. So again, it's not a habit. This is a disorder, unfortunately. So because it's a disorder, it means it's harder. It's harder to manage. And it's something that's going to be with you and that you're going to kind of be aware of, slightly aware of, unconscious of all the time. Doesn't mean it's going to be active all the time, but it's going to be within you. So suggestions, think about what you did to stop your hair pulling, and do the same thing. So the same strategies, the same treatment, because again, it's still a BFRB. It just kind of came up in a different way. Um, so things like blocking yourself, for example, um, right? Or if you're picking, maybe putting your hair up in a ponytail and a bun, covering it with a hat just so you can't really get to the split ends, cover mirrors so you're not looking, um, things like that. And of course, fidgets. So kind of back to the basics, back to what you were doing before to try to manage it. Again, think of SCAMP. So managing it in terms of sensory, cognitive, affect, motor, and place. Is it common for a preteen 12-year-old to outgrow it? Well, I don't want to be the bearer of bad news, but but around this age, 12, 13, 14 is the common age, the most common age when it starts. And that is due to puberty, and all the changes in the hormones. So when it starts around this kind of puberty, teenage, preteen, teen time, um, it's most likely going to continue. Um, but that doesn't mean that it cannot be managed. And that does not mean it's going to impact their life forever. It does not mean there is no hope. So, get in there early if it's just starting and work on the strategies, kind of get into patterns of using the strategies, so it becomes more natural. And part of that, if you're noticing it again at that age, um, love, encourage love, be supportive, no punishment, help them work on it. Because the less shame and guilt that they're going to feel, the better it's going to be. The more shame and guilt, the worse. The worse they're going to feel, the more they're going to pull, the longer it will last. So that's what I would say. Uh, so does Trick have a relationship to autism's stemming textures? So um, it's it's different. Some people get them confused. So if you autism can be a co-occurring disorder. So if you do have autism, um, check to see if you have stemming behaviors, or if it's trick. So you can have autism and you can have stemming, and you can also have trick, or you can just have autism and stemming and not have trick. So it's a little bit confusing. So if you are connected with a doctor, make sure you get evaluated by a doctor. Oh yeah. Excuse me. So I answered this question in the very beginning. How do you get trick? Why do we have it? In fact, I think that was like exactly how the pre-submitted question was. So we get trick. Again, research is a little bit unclear, and it's complicated. So there really is no definitive answer. But how you get trick is, right now, research is showing there is a large genetic predisposition. Um, but just because it's genetic, just because it's within the family, does not mean that you're going to have it. So it's a combination of things. So that genetic predisposition, along with other factors like hormones, like temperament, age of onset, and environmental stressors. So that's kind of that combination of things is kind of why it comes up. What are your thoughts on hypnotherapy to help? Um, yeah, that's a good question. I say any therapy that is not going to harm you is worth a try. Different things help different people. Different people are responsive to different things. So hypnotherapy is not going to hurt. It's worth a try. In general, that's not a recommended or empirically based treatment for trick. Um, but again, worth a try. From what I know, people who have gone through hypnotherapy say that it's helpful, but helpful temporarily. So I have not heard too many stories of it helping long term. But even if it works temporarily, maybe that will give you a chance to work on other strategies and kind of build your muscle memory, your strength, your resistant muscles. Um, so that you can practice those strategies, become ingrained, and then it'll be easier to use later on when the urges return or are strong. Um, so yeah, so again, why not? It's not going to hurt, but that's typically not the go-to treatment. Oh, so why is it more common in girls? So it appears to be more common in girls. Um, I guess right now research shows that it is more common in girls, um, uh, but that's not necessarily accurate because it is certainly present in males and boys and men. Um, the thing about that is they are less likely to talk about it. They are less likely to receive treatment for it. So they're less likely to put themselves out there. Therefore, they are not kind of captured in the research in the databases, I would say. So it can affect both male and female equally. Um, but generally speaking, females um, tend to be more verbal about it. So they tend to participate in more research, tend to go to therapy more. So it is more known um, for it to be in girls, but it's not necessarily more common. Um, so far, it appears to be, but I don't know if it actually is. So just something to think about. You're welcome. I see a thank you here. Yeah, thanks for joining. Let me see. Oh, good question. Yeah. So do you have suggestions for working with a 26-year-old son who is resistant to getting help with trick? Yeah, I really like this question because if the person with trick does not want to get help, um, then they're not going to get help. I know it's frustrating for you as a parent, but they have to want to be helped. They have to want to work on it. If they're not in a place yet where they want to work on it, then going to therapy or forcing therapy, it's not going to work. Um, if it's not impacting their life, for example, then maybe that's a reason why they don't want treatment. Um, or it's not bothering them, it's not impacting them, bothering them. Or if they're embarrassed by it and they just don't want to talk about it, that's pretty common as well. Then it's something that they're going to have to kind of sort out on their own. um, if someone does not want to go and get help and talk to a person, maybe he would be more willing to kind of do some self-help stuff. So like we talked about some of those books, so he can kind of silently work on it on his own. Um, So he does not need guidance from a therapist. Working on your own, like going through some of the books on your own, might help him realize that, oh, he actually does want some guidance, and does want someone to talk to about this. So starting with books might help to lead towards working with a therapist. But unfortunately, there's not much you can do as a parent. If he doesn't want help, if he's not ready, it's not going to work. So he has to be ready. Okay. Actually, those are all the questions that came in. Whoop, I got some thank yous. Okay, we got another question. Yeah, so if you have more questions, keep them coming. I can stay a little bit longer. So, yep, thank you. Hope this is helpful. Yes, so the supplement you mentioned, would they be safe for a preteen? So NAC, so yes, yep. So NAC, again, it's an amino acid supplement. So it's kind of like a vitamin. I would kind of, I guess, put it in that category. Um, so really, it's got very little to low side effects. I think the most common side effects people have experienced are like upset stomach, maybe nausea, upset stomach. And if that does happen, you can also change brands because sometimes people react to different brands. Um, but again, and don't just start a medicine, talk to your doctor. Make sure you consult with your doctor before doing anything. But in general, yes, it's perfectly safe for a preteen. Okay. My friends do not know about Trick and comment on my hair and keep asking questions about why I pull out my hair. I am embarrassed and don't really know how to talk to them about it. Yeah, well, my first question would be, do you want them to know? So if you feel comfortable and you want to tell them the truth, give them some education, send them to, for example, trickstop.com so they can read some articles and get some answers so they can better understand. When they have resources, that's really helpful. The more education, the more awareness, again, the more it's out there, the better it'll be, the less shame you're going to feel. So you don't have to talk to them if you don't want to. But if you do, send them to some websites so they can get some more information. Let them know how they can be supportive. Um, Tell them it's a disorder, and it's not something I can just stop. I'm just going to read the question again, make sure I didn't miss anything. Yeah, I'm wondering, what are they commenting on your hair about? About why I pull. Yeah, so if you want to, you can also, if you don't want to go into great detail, but you want to give them some kind of answer, usually some little answer suffices. So why do you pull your hair? I mean, the reality is because you're trying to self-soothe. Oh, I try to self-soothe myself. Or it's a way to regain balance. I'm either understimulated or overstimulated, or it's a disorder. Right? I wish I didn't do it, but I do it. It's a disorder. Um, I kind of like that last way of saying it the best because it has a little bit more of the education aspect. It's a disorder. And no one's going to what are they going to say that you have a disorder? If they're your friends, they're going to support you no matter what. And they're going to want to know, oh, it's a disorder. Oh, tell me about it. So I kind of like that way of approaching it. Uh, for more context, they're commenting about my bald spots and uneven hair length. Yeah. And if you don't want to tell them, and you don't even want to say it's a disorder, you don't want to tell them that you're pulling it out, you can just make up an excuse. Oh, I know, like my hair grows back funny, right? Oh, I got a bad haircut. Oh, I got caught in something. So you can certainly make up an excuse if you want to. They don't need to know any details. I don't, they should not be commenting on your bald spots though and uneven hair. No one's hair is perfect. um, if they're making fun of you and like talking about it in a bad way, then they doesn't sound like they're good friends. Maybe it's time to find some better ones and more supportive ones. Because friends aren't going to care. They're not going to care about a bald spot. They're not going to care about uneven hair. Okay. So, in summary, think about if it's something you want to tell them, if you think it would be helpful, um, because you certainly don't have to. Okay. Um, did that answer your question? Or do you need some more follow-up? Or does anyone else have any other questions? Okay. Yes, it answered my question. Thank you. Okay, good. Um, if another question pops in your mind that you didn't get to ask tonight, we're having these somewhat regularly, so you can always join again. Happy to have you. You can also email questions to support@trickstop.com, and we will be happy to answer any of your questions to the best of our ability. Okay. Um, so yeah, thank you so much for joining. And till next time, we will end for tonight and hope well, I'm not seeing you, but you're seeing me, so hope to join again for next time. Okay. Thanks so much, everyone. Gonna stop the recording.